the concept and the measurement of person-centered care. So this is going beyond outcome-driven activities to really people-centered healthcare. And it means practicing healthcare in partnership with the patients and with individualized attention to each person's unique needs and perspectives. It's a really exciting area of work, and we think another field where Uganda is really going to lead the way in the health sector and globally. This is one area I did want to add where we do have particular concerns around the Anti-Homosexuality Act and the barriers that can pose to realizing this goal. If there's an environment of fear or uncertainty or a concern about reporting, then it can result in a change of how or if vulnerable people seek care. So while we think this is a tremendous opportunity moving forward, this is part of the reason why this legislation is so concerning to us. And so I wanted to add that point. Uganda's made really significant strides over the past decade in addressing discrimination in the health sector, and we want to see this move forward, and we want to be part of that journey as well. Using a patient-centered approach, we can build a strong and resilient healthcare system that serves all members of the community equitably. The second priority that I really wanted to highlight is the People's Voice Survey. So this is an innovation that we're excited about introducing with the Ministry of Health. It's a new survey that's rapid, low cost, and population representative. If you are not familiar with this survey, there was a Lancet series, a Lancet journal series that was published just less than 2 months ago. And the series outlines how this survey has been implemented in 14 countries around the world, including some of Uganda's neighbors and the United States. And for those of us who've been part of work to do exit surveys or try other methods to understand people's experience of quality of care, this is really an exciting innovation. The survey, which is phone-based, aims to promote health system accountability to the population. It can track the impact of reforms and policies over time and inform actions towards a more effective and person-centered health system. The process is that you call individuals around the country and gather information on their experience related to the quality of care they received over the past 12 months. As we use this approach to expand the pool of individuals who can actively advocate for the health system, we can accelerate progress towards our health goals, including controlling malaria, reducing teenage pregnancy, and putting an end to the HIV epidemic. The third area of innovation that we are particularly focused on is looking at taking our approach to quality improvement beyond just the facility level and specific outcomes, but applying the same principles to redesign and enhancing systems at the national, regional, or district level. This evolution in strategy from focusing on health outcomes to full systems redesign is a key topic in the global discourse on quality improvement. And it marks a significant shift in mindset from enhancing what exists, like improving a candle, to innovating entirely new solutions. So in this case, creating a light bulb. I had a copy of my speech out last evening, and my 10-year-old got a hold of it, and she was looking at it, and she said, "Mom, I hope before you go tomorrow, I see something about a candle and a light bulb here. I hope you make sure what you're saying makes sense before you say it in front of a big group of people." Oh, and it really stuck with me. But I love this analogy and thinking about the work that we're doing right now on improving newborn results, looking at complementary feeding, looking at ANC, all of these specific health outcomes are amazing and have really achieved results for Ugandans. And taking those same principles to tackle some of those really sticky systems issues like commodity accountability, the management of district health systems, health worker performance is an amazing opportunity to move forward. So we as the US government are really committed to being with you and part of these innovations and part of the change that's sought by the stakeholders who are here today. Your daily efforts, especially in this environment, are impressive, and we look forward to seeing all of the presentations and posters over the coming days. Through collaboration, we're certain that we can achieve sustainable improvements in the health system. On behalf of the US government, I express our profound gratitude for your commitment and wish you all a fruitful, cooperative discussions throughout the conference. Thank you.
Thank you very much, Jessica. Another round of applause. This is the first Quality Improvement Conference you are attending, and we welcome you, and we appreciate the highlights of the priority areas for focus that you've given us. You're most welcome. Okay, so now we receive remarks from WHO, country representative, represented by Dr. Elizabeth Mugambo Adhiambo. Please welcome her to make remarks. You're welcome, Dr. Elizabeth.
The Honorable Minister, representative of the Director General, directors and commissioners of the Ministry of Health, district health officials and healthcare workers in the House, the health development and implementing partners, all guests and delegates, ladies and gentlemen, good morning. Good morning again. Yes, so to introduce myself again, I am Elizabeth Mugambo, Emergency Preparedness and Response Team Lead in WHO Country Office. But today I'm here on behalf of Dr. Jonas Tegen, who is away in a mission. He sends his greetings. Just also to highlight that I've been a quality improvement champion in my former life, and I think this has also lived with me, and it has become a way of life. We all know that with quality improvement, it applies in everything that we do. So I am really happy and honored to be with you here today. So I am pleased to be part of this 10th National Quality Improvement Conference. The theme, Innovations to Strengthen Health Systems for Delivery of Quality Healthcare in Resource-Limited Settings, is timely, as we are 6 years to the end of the 2030 Agenda. Although progress has been disrupted by various public health emergencies in the recent years, innovations for strengthening the healthcare systems will actually play a pivotal role in accelerating our progress towards universal health coverage. Indeed, Uganda is a hub of innovations. Uganda is a country where the country that leads the way in most of these initiatives that comes along. And this, together with a 15 years journey in quality improvement, plus many other interventions in the country, have yielded results. And as a result, Uganda's Universal Health Coverage Index has progressively increased from 22 during the year 2000 to 49 in the year 2021. This is no mean achievement, and we need to applaud the country for that. This is a big improvement because even a 1-point improvement in universal healthcare coverage index is really, it takes a lot of effort to get there. So even with the increased access to services, health improvements can still remain elusive unless the services are of sufficient quality and are effective. This conference therefore provides an excellent and timely platform for reflection, for learning, and also for refinement of the innovations for strengthening health systems in order to deliver quality healthcare and accelerating progress towards achieving UHC. And indeed, I believe there'll be a lot of learning that will take place. Yesterday I was going through the agenda and going through the various presentations that will take place both for the orals, for the poster presentations across the different building blocks for the health systems. It was quite amazing to see all that. Really, I counted there are over 200. And I was like, wow. And when I was looking at the titles for each of them, it was so impressive. And it is my hope and desire that during this conference, the learning that will take place will go a long way and be weaved back into or scaled up even into higher levels. And there will be cross-learning also taking place across the different levels of the health systems. Ladies and gentlemen, innovative actions to strengthen the health system should aim to achieve health system resilience. And resilience is a situation in which all health-related actors and functions collectively mitigate, prepare for, promote, and recover from disruptive events while continuing to provide essential health services and functions. These actions should be guided by some core principles. But before I go to the core principles, resilience is key, building resilient systems. Especially in this day and era, we have all seen the impact that we've experienced from the COVID pandemic. Again, for Uganda, EVD outbreak came. It was controlled really in a very short time. The country did a lot. But still all these impact progress and the impact delivery of these essential health services. So therefore, we really need to work together to build the resilient health systems. And these are the core principles that will guide this: government, ownership, and leadership. And for sure, we have seen this for Uganda. Honorable Minister, we appreciate the leadership. We have seen your commitment. We have seen the determination. We have seen your drive for results. And this translates to the entire system. It also requires a whole of government and whole of society approaches, because when we look at a number of issues that come to the health sector, for some of them we are on the receiving end, but it needs other sectors to come together when it comes to that prevention to ensure that we are not always on the receiving end. So we have the social determinants of health, and therefore the whole of government approach becomes really very critical. Leaving no one behind. Again, this is an important approach, that no one is left behind. Again, another principle is on sustaining essential health service delivery while managing health emergencies. Again, this, we cannot overemphasize on this, but we all know and we all have seen this. Engaging and empowering communities. Communities are at the forefront. Let communities continue also having their voice, speaking so that they are heard. And through empowering communities, then we are able to come up with approaches that are able to address really the specific needs of the individuals and also of the communities. Learning from the previous emergencies and to improve health policies and interventions. Every emergency is always a learning opportunity. There is always something we learn. There is always something we learn that we need to do differently. And again, with emergencies also, they've also provided an opportunity to further enhance and build the existing health systems, because everything always starts from where we are, from what we have. And I really want to applaud Uganda also on this, even when it comes to the health emergencies. I see the coordination is at another level. I see the emphasis on using what already exists and improving on that. Because sometimes you could have instances where, if this is not done well, you find many innovations but outside the mainstream health system. So in the end, once funding is gone, nothing is left. Everything is closed. But I have seen in Uganda there has always been an emphasis on using what exists. And therefore that provides an opportunity also to further enhance the health systems. So towards improving the quality of healthcare in Uganda, the World Health Organization continues to provide technical support in the development and implementation of a national quality strategy, the development of quality of care measurement frameworks, and promoting of patient and healthcare worker safety initiatives. We have also worked closely with the government, with the Ministry of Health, with the partners, in strengthening of infection prevention and control practices and the country efforts towards community engagement to achieve integrated people-centered service delivery systems, though a lot still needs to be done. And again, we are looking forward to keep on working with the government, the Ministry of Health, and also all stakeholders on these areas. So ladies and gentlemen, as I conclude, I thank the government of Uganda, the donors, the implementing partners, frontline health workers, and communities for the great collaboration that has enabled the country to achieve the milestones towards the delivery of quality care at all levels of the health systems. I call upon all stakeholders to use all the lessons from this conference to build strategic partnerships and to scale up the innovations that will strengthen resilient health systems with quality healthcare provision. Indeed, building strategic partnerships is important. We all need each other, we all have different strengths, and this diversity, while leveraging on the strengths for different partners and also different members within government, different teams, different levels of the health systems, this is what will get us there. We all need each other, so let us all keep working together towards this. I wish you all successful deliberations. Thank you.
Thank you very much, Dr. Elizabeth, for those wonderful remarks. Another applause. Let's appreciate remarks from WHO. Okay, so now it's my pleasure and honor to invite our chief guest, the Honorable Minister of Health, Dr. Jane Ruth Acheng Ochero, and a Member of Parliament for Lira City, to come and greet us and officially open this conference. You're welcome, Honorable Minister.
Thank you very much, Dr. Kware. Since you said I first greet you, allow me to greet all of you. Good morning to you all. And thank you very much for coming in such big numbers. Our development partners, the Director, Health Services, Governance and Regulations, our health implementing partners, officials from ministries, departments and agencies, representatives of civil society organizations, the health professional councils, directors, from both national and regional referral hospitals, district health officers, the media, invited guests, and all conference participants, including those online. It is a pleasure to welcome you to the 10th National Health Sector Quality Improvement Conference. You know, you sanitized this place, and the microphone is just sliding away. I need it cleaned a little bit so that it can remain in one place. So allow me to welcome you all to the 10th National Health Sector Quality Improvement Conference, and also to appreciate you for taking off time to come and spend 3 days discussing quality improvement. I also take this opportunity to thank you for the work that you're doing in improving quality of health services in this country. Listening to the speakers before, we are all aware about the progress that we have made, and yet a lot still has to be done in many areas if we are to offer quality services to our people. I want us today to reflect a little bit on the health systems building blocks of WHO. When you look at the various parts in the 6 areas, there is a lot that needs to be done in the areas of governance and leadership, health workforce, information systems, service delivery, medical products, and financing. And I am glad that each of the speakers that came here mentioned these areas. We have 6 years left to 2030. And everybody thinks 2030 will be a miracle year. Many of you will recall the Millennium Development Goals. I think somebody's microphone has just fallen down. Many of our African countries have an unfinished business as regards the Millennium Development Goals. And this unfinished business keeps on pulling us behind, even when we try to move forward with the Sustainable Development Goals and also our quest for universal health coverage. There are challenges that we continue to meet, especially in the areas of financing. And the good news is that financing is not improving. Now, many of you are now very alert asking me, is that good news? Yes, it is good news. It is good news because then it takes you to the innovations that you're talking about. We need more innovations so that we can continue to strengthen our health systems. And we don't need very expensive innovations. I will tell you something that happened recently, not very long ago. And there are some people in this room here who are aware. The 11 high-burden countries for malaria were invited to Cameroon for a meeting. and I was part of it. At least I know WHO is aware and USAID is aware. During that conference, reality set in because it was very clear. Partner after partner came to speak, and they said the world has moved on. They have moved on to climate change, to global health security, to wars in the various areas, and for you, you are still on malaria. You are still on malaria and TB. We've moved on. So you need to look for your own domestic resources and end your malaria. End your what? You say my malaria. Yes. We need to look for our own domestic resources and end our challenges. And we can only do that with innovations and quality. I was very happy during that conference, and by the way, there was a declaration. In that declaration, we are all declaring that we are going to get our own resources. So I declared on your behalf. Yes, I had to declare, whether you are happy or not happy, all the 10 countries, 11 declared. And I have the declaration with me. And when I do it, I have done it on your behalf. And I was saying that I was happy. Happy because we need quality even in our financing. We need to be people who are realistic, that every dollar, every penny should translate into something tangible to touch the lives of the people. There is a lot of wastage in this country, genuine wastage. At every step, every process, we have wastages. We need to start tightening the nuts along the lines of wastages and put in more innovation. Not only in financing, we need innovations in ensuring that our medical commodities, the products, the technologies we are using actually benefit the end user. Are we able to track our medicines up to the beneficiary? And when you're asked for accountability, can you, by a click of a button, produce accountability? We need quality in service delivery. Do we keep time? And do we do what we are supposed to do adequately? Or we all come and we practice being around. And there is a lot of being around even in conferences, because we walk in with our phones, mobile phones, laptops, and somebody is talking and we are busy on WhatsApp, SMS, you're laughing with the, people, and things pass you by. And when things pass you by, you have missed the point here, you continue to miss that point. And we pick on this, carry it with us into our areas of service delivery, and there is no quality. We are losing maternal lives because we are not concentrating, because we are not thinking, because we are not giving in enough time. I was challenging people during the conference where we were discussing blood a few days ago, the African Society for Blood Congress. And I said, for a long time in this country, we have relied on blood from our children, because when the schools are closed for holidays, there is no blood. And then when the schools are open, we are all running to look for the children, because we want to bleed them. And yet, the age for donating blood ranges from 17 to 65. meaning that all of you in this room are eligible donors. But why don't you want to donate? Then all of you will be saying, we are not sure of ourselves. And yet you are the people that are discussing quality. If you're not sure of yourself, why don't you go and find out so that you become very sure and you know whether you can donate or not donate? Suppose one day the children say, we are not giving blood, don't come to our schools. Are we going to die? Are we going to die? Yes, we are going to die because many of you here don't want to donate blood. So I am challenging us at every time that we are doing something and you're thinking about quality, also think about the lives of the people and think about yourself. What if it were you? I was told of a story of a pregnant girl, 17 years old, recently, severely anemic, with difficulty in breathing. Perhaps she was in failure. In a health center 4. She was put on blood, she was not improving, and she was transferred to a regional referral hospital. Upon reaching there, the regional referral hospital received her, attended to her, and after a few hours they wanted to discharge her because there was no blood in the regional referral. Now, discharge her from a regional referral to go where? To go where? And yet she has come where there are specialists, where there is equipment, where there is better health services. Now, she has come from a lower health facility to a better facility. The better facility wants to discharge her. So which one is the better one? Isn't it the one that received her and gave her some blood? The health center 4. You can imagine the irony of things and the challenges of the system in which we work. So even when we are thinking about quality and innovations, let's ensure that the products reach the people. Of course, the other areas of governance and leadership are extremely important. And you must lead by example. You must be a committed leader, not a politician. There is a difference between politicians and leaders. But there are times also when you can interchange. One time you are a politician, another time you are a leader. But it is always good to be a leader so that you inspire people to do the right things. But don't come and tell a lot of lies and then there is nothing done at the end of it all. There are many of our leaders in our health system at every level who are very good politicians. Even when we go for support supervision, they will say all the nice things, but when you go to look for the nice things, you will not find even one. In other words, they are absolutely absent and only present when people go to see them. So this conference is yet another opportunity for us to share experiences, challenges, and opportunities, and tested solutions in the implementation of quality improvement healthcare in our country. There has been a lot of effort in trying to ensure that we instill quality at every step of our work. I recall there were many hospitals where 5S was introduced and supported by JICA. One of them is a hospital where the director governance comes from, which I visited recently. And I wanted to see the traces of 5S. The traces. I'm just talking about the traces. I looked around, I tried to bend. And yet, these were serious investments in terms of dollars. So one of the painful things we go through is that when we are getting support from partners, we are all into it. When the partners withdraw, we also withdraw. And the painful thing is that we are withdrawing from our own systems. The partners come in to support. So if you withdraw with them and you destroy the system, then was it really worth the support? I really want to urge us all to be more committed. I also want to encourage the planners at the Ministry of Health to pick and take note of the various issues or innovations that need scaling up at all levels of the health system. I love the theme, innovations, and as I mentioned earlier, it emphasizes the need for strong health systems for quality health care. It calls for all of us, players in the health sector, to use these innovations, and remember I said they don't have to be expensive, amidst our challenges to improve the quality of care. You can even use innovations to improve the lead time for procurement, lead time for requisition of funds, lead time for many things. In some of our institutions, including the Ministry of Health, some procurements can take 3 years. Can we put in some innovations? Shorten the time period, get the things out early. Requisition of funds just to go and do something. Perhaps there is an outbreak somewhere. It takes like forever. And then the minister has to run to WHO or USAID. Can you please chip in quickly, as we are still going through the bureaucracies of government? We can shorten that. And that is putting quality in our actions. It also dispels the belief that quality of healthcare services can only be improved with a lot of resources. And that is why I started by telling you that now reality has set in, and we have to demonstrate that improvement can be achieved within the limited resources. I would like to urge all participants in this conference to use the opportunity to continue highlighting and sharing the unique ways through which you are using quality improvement initiatives to improve service delivery in your areas of jurisdiction, and also to ensure that quality improvement is institutionalized at the different levels of the sector and come up with solutions that can be shared across the board. The ministry will continue to make investments in the national health system. Many of you are seeing the infrastructure that government is investing in, the Health Center 2s, the Health Center 3s, which is meant to ensure that we reduce maternal mortality and child mortality as much as possible. And I am glad that we set targets, and now we are going to launch the guidelines to help us implement the various documents that we have at hand. In a special way, I would like to appreciate His Excellency Yoweri Kaguta Museveni, the President of Uganda, who saw the need and the importance to enhance our salaries. Unfortunately, yes, everybody is, some people want to clap, others are not, perhaps others did not benefit. Unfortunately, it is very clear that the salary enhancement has not translated to better quality. It is very clear. from the surveys that are being carried out by Ministry of Finance and others, it is not translating into better services, better quality, and we are yet to see if it will translate into better health indices. So I would like to appeal to all of you to do more, to sustain what we have already achieved, and also improve as we move forwards into the years. The people we serve are yearning for better results. We look forward to a time when we can work very closely with all of you through one plan, one budget, one monitoring and evaluation. And we are going to be very serious about this. We don't want any more fragmentation, silos, vertical programs. We need to integrate everything under one leadership so that we can all boast of our achievements together. And when we have not done well, we also look down on our failures together. As I conclude, allow me to appreciate our development and implementing partners for supporting the initiation and growth of quality improvement initiatives in the health sector and bringing us now to the 10th conference. We are very grateful to you all. I would like to recognize the SCAP department at the Ministry of Health under the leadership and guidance of the PS, the DG, and the Director Governance for steering quality initiatives in the sector. I would also like to appreciate in a special way the frontline health workers at the facilities who are the foot soldiers of change towards improved health service delivery that we have achieved so far and where we are going. And also to continue to remind you, especially the frontline health workers, that even as you give services, remember to protect yourself. That is part of quality. Remember to protect yourself. Uganda is a country that is very vulnerable to outbreaks. Even when the system is quiet now. Is it quiet? Is it quiet? It is not quiet. Don't we have foot and mouth disease? So it seems some of you, those who said yes are eating meat. I am sure that all of you saw the letter saying don't eat meat in Kampala. So we shall check today if they have cooked meat here. Allow me to congratulate all those whose abstracts were accepted to be presented and discussed in this conference. Finally, allow me also to appreciate those who are online, who took off time to join us in this conference. And before I take my seat, I would like to thank the following in a special way. The Global Fund, USAID, Uganda Health Activity, the Makerere University School of Public Health Monitoring and Evaluation Technical Support, that is METS program, USAID Family Planning Activity, Japanese International Cooperation Agency, JICA, USAID maximizing options to advance informed choice for HIV prevention, USAID social behavior change activity, and the Uganda COVID-19 response and emergency preparedness project. All these partners made it possible for us to be here today. Allow me also to recognize and appreciate our keynote speakers who have taken off time to prepare the keynote addresses to share with us extensive knowledge, experience, and also encourage us in our quest for quality improvement. I would like to recognize Professor Handa Yujiro from JICA, Professor Henry Tumwine from Kabale University School of Medicine, and this one, by the way, is my teacher, and Professor Peter Waiswa from Makerere School of Public Health. I thank you all for listening to me. It is now my honor and pleasure to declare this 10th National Health Sector Quality Improvement Conference 2023 officially open for God and my country.
Let's put our hands together again to appreciate the Honorable Minister for officially opening the conference. Honorable Minister, we have listened, and the country has listened to you attentively. Thank you for the straight talk. We need to tighten our belts because the road is getting rough and rougher each other day. Once again, thank you so much for those words of caution and guidance as the political lead of the sector. Innovations throughout the system, health system, will lead us to quality and better results. Now, Honorable Minister, we are moving on to launch the 2 documents, and then thereafter we receive our first keynote address. It will be less than 20 minutes, and it's around the same issue of health system strengthening. The keynote address will be delivered by Professor Peter Waiswa from Makerere School of Public Health. Waiswa, I'm corrected, Peter Waiswa. And the address will be around understanding health system strengthening in a resource-limited setup. And that's what Honorable Minister has just been talking about. So may I now invite the officials that will join the Honorable Minister to come and launch these 2 documents. May we have the copies ready and the markers ready for this exercise. We need the copies also ready. They are ready. So let's have WHO, USAID, Dr. Elizabeth, Dr. Jessica, JICA, chiefs of parties, or officials representing our partners, the chiefs of parties, UHA, UHSS. If you are present, please come forward. Directors of regional referral hospitals, if you are here, please come forward. DHOs, please come forward. We have Makerere University School of Public Health. Please come forward so that you be with the Honorable Minister as we launch these two very, very important documents. One, we shall start with the survey, the report. And Professor, you can say something about the report. Just a summary, because she missed the presentation in the morning.
Yes.
Yes, my teacher too.
Honorable Minister, our report found that overall general health service index in the country has increased to 59% from about 48% way back in 2018 based on the SARA finding. This is one. Two, we found that overall services availability in the country at the national level, at the regional level, in the higher level facilities, the national referral hospitals, the regional referral hospitals, the general hospitals, is as expected higher, but at the lower level facilities, the availability still remains low, as would be expected, especially in the areas of communicable diseases, immunization, and so on, where we found in these areas, we found generally availability of services were good. Of importance, Honorable Minister, we found that readiness to provide services, especially for non-communicable diseases, cancers, remain low. This is an area that needs focus. We also found that readiness to provide emergency services, especially transportation systems, needs to be strengthened. This is what I like to report to you very briefly. Thank you.
So, Honorable Minister, we now invite you to launch the Harmonized Health Facility Assessment Report. Thank you very much. Applause. The hard copies are available, voluminous and rich. Can we have the other officials to sign this as we prepare to launch the next document, the guidelines? In the meantime, Dr. TMK, please summarize what this next document is all about.
Honorable Minister, I present the Quality of Care Implementation Guide for Reproductive, Maternal, Newborn, Child, Adolescent, and Nutrition Services that was developed by Ministry of Health under SCAP leadership and reproductive health and implementing partners support. This guideline outlines the organizational structures at the Ministry of Health, at the center, and all levels of care. It outlines the leadership and governance and accountability for RMNCAH services, also at regional level, district and community level. It also outlines the quality improvement activities that will be implemented to improve RMNCAH services, and later describes the data management systems, including the monitoring and evaluation frameworks and indicators for RMNCAH services. And finally, it describes the RMNCAH research agenda that will be used to implement RMNCAH services. So this is the guideline that we present to you for launch. Thank you so much.
Thank you very much, Dr. TMK. Honorable Minister, we now invite you to officially launch the Quality of Care Implementation Guide for RMNCAH and nutrition services in the country. You have the copies. Thank you very much. Let's now sign, continue signing. WHO, you are the mother of guidelines. Once we see your signature there, then we know that this is authentic. The cameras should get ready, because after this we take a picture and then we take our seats again to listen in to the keynote address. It will be brief. Then after the keynote, we go for coffee. Sign. USAID, sign.
So as the signing continues, I've been requested by Director to inform you on how the photo shoots will be. The first shot will be the Honorable Minister, the Senior Management of the Ministry of Health, that's the commissioners, assistant commissioners, of course, and the Director, and development partners. That will be shot number 1. Shot number 2 will be the Honorable Minister, of course, the commissioners and assistant commissioners. Those are constant and development partners. Then the addition will be the IPs and those from academic institutions. So the first one has the constant, which I've said, the Honorable Minister, commissioners, assistant commissioners from MOH, and development partners. Okay, the big one, so others will stand up, and then we shall start by separating. Those of you who are vertically challenged, you just take up the podium.
We are done.
So thank you. So the ones in front can stay, of course, the Minister of Health, and then the development partners. So that's the first one. Not really. You can just put them down because the books are too heavy. Okay. So let's take, if the books are heavy, okay. So Alex Benson up. Very good. Of course. Director Joseph, you can stay down for obvious reasons. Vertically enhanced. Okay, the second set will include the IPs and those from academic institutions. Professor Raj? No, those you are constant. MOH, you are constant. Hey. Okay, now we have the... Yes. Okay. Academic institutions, okay. From academia, please, can you join in very fast? Let's do it fast. You are key. You are very instrumental because you skill the health workforce. The cameraman, you let me know if it's not balanced. Are you done? Okay. Now we go to the other one. So the constant ones you stay. So we need now the DHOs and director of regional referral hospitals, just to be. Of course, the last one will be the same constant with the presenters. So the DHOs and our directors of regional referral hospitals who are around, please, we like you so much because you are our frontline team members. Okay. Dr. Kware, if you go upward, our photos will be out of focus. They will be over-skewed. You just, Liam Musajja wa Kabaka, so at least that's fair. DHA, Dr. Kamye, you are most welcome. Hey. So the camera crew, get that one very well. Thank you so much, the DHOs. So the constant is the last one. The DHOs and hospital directors you can get off. So now with the presenters. The presenters who are around, because you are going to enrich our conference over the 3 days. So Professor Peter Waiswa, for you, you will be online, you will miss out. So we shall do some Photoshop editing just to put you on, and maybe the other keynote. Please go behind, don't widen it. Just go behind. Yeah. Honorable Minister, we have a number of presenters, both oral and poster presentations. So they will find themselves, that's why the number is big. No, you just, if you want to appear in the photo, just go behind. Because it won't. So even if you stand in front of Director Joseph Okware, you won't be affected. So for you, I've decided to. No, here you are not seen from here. Uh, yeah, the gentleman, you can do the needful, you can just squat in front. So the online presenters, you just turn on your videos thereafter, and we shall see how to merge them. Benson will appear in all the 5. Okay, the last shot. Okay, thank you so much. And over to you, Director Kware, to take us to the next.
IT. Okay, so welcome back from that session. The conference is now officially launched and opened. The 3-day QI conference is now opened. And we are ready to receive our first keynote address. I just want to make sure that the IT people here are compliant. Dr. Waiswa, or Professor Peter Waiswa, are you able to hear us?
Yes, am I able to hear you? Can you hear me?
Very good. We want to see your face. Are you?
Recording stopped.
So, Dr.
Recording in progress.
That echo. Dr. Waiswa is an associate professor of Health Policy, Planning and Management of the School of Public Health at Makerere University College of Health Sciences. His focus areas are mainly health systems, implementation research, and policy influence in reproductive health, maternal, newborn, and child health. Dr. Waiswa is a member of the WHO Quality of Care Uganda and global networks, and has led many QI innovations in the health sector in Uganda. IT, Professor is not able to hear us. Professor, can you now hear us? Can you hear me? Professor? The echo. Why are we getting this echo? Hello? Professor, we can hear you loud and clear.
Okay. Thank you so much for the invitation. Honorable Minister, the USID Health Country Representative, Jessica, and that you have to Uganda before. apologize that I'm not with you. I'm actually in the, I'm in the restaurant for a meeting, and I just got this invitation to present last Thursday, which made it difficult for me to be with you. So I apologize for that, but I would have wanted to be with you there. My presentation is understanding system strengthening in resource-limited settings like Uganda. I must say, the minister, the USIPA representative, and the WHO have already talked about most of the issues I'm going to talk about. I just wanted to start with what I call a key message for my presentation, and I will come back to it at the end, that health system strengthening requires, one, capacity to manage complexity. So health systems are complex, and they need to learn how to manage. And management for me is a critical word to manage complexity to deliver integrated and good enough minister, as I emphasize this, packages of evidence-based interventions with a target goal in mind. And the goal for the health system is actually clinical health outcomes. Now, we're talking about health system strengthening. What is a system? A system is defined as any group of interacting, interrelated, or interdependent parts that form a complex, and the unified whole that has a specific purpose. As you can see, health systems are not just people, not just clinics, not just hospitals, not just the Ministry of Health. They are different components that must be working together in an organized way for a specific goal or purpose, which goal is to improve health outcomes. Now, this thinking about health system is actually a bit recent, because the world historically has been a world of medicines, of vaccines, and hospitals. But in around 2000, in a report by WHO, which is made by the Alliance for Health Systems, the World Health Report 2000, which was health systems improving performance. This is the first time that WHO systematically started bringing the issue of health system to the fore. And over time, almost every year, WHO publishes different key documents from the Alliance for Health Systems that talk about what are health systems. The most recent, where systems thinking was defined, was 2009. And after that, we've gone through various improvements in understanding what health systems are. Now, in the report of WHO in 2007, WHO defined what are health systems. And I think it is important that all participants have a good grasp of what are health systems, because once you understand them, then you can think of how to manage them. They were defined as all organizations, people like health workers, like sweepers, like community workers, and actions like immunization, health promotion, treatment, whose primary intent is to promote, restore, or maintain health. And WHO went on to add that this must be done in a way that improves health outcomes in an equitable, responsive, and financially fair, and make the best use of resources. So the minister has talked a lot about efficiency. Efficiency is at the core of health systems. We cannot be wasteful. And she said that she's happy that we don't have much money. And I also agree. I always say the measure of a good manager is how much you have done with the resources you have, or with what you can do as a manager before you ask for more. So that is, supportive of what the minister said. We all know that health systems are actually at different levels. Primary care, which includes communities and community facilities. Secondary care, which includes most of the general hospitals. And tertiary care, which is mainly regional and also national hospitals. At all these levels, we need health system strengthening. expand on the building blocks because they find that other systems are important in influencing outcomes of their systems. But sorry, all of a sudden the internet has been good, has become problematic. So I will zero. I hope you can see the presentation. But we take the building blocks as the main as of now. Governance, human resources, financing, service delivery, health information systems, and medical products are the building blocks. Now, typically we think that when you have inputs, money, etc., let's workforce, you get outputs, and you get outcomes, and you get impact. The minister has already alluded that we've increased the pay for health workers, but we don't have outcomes. Because mainly, we have done one component, which is basically improving salary, but systems are complex. Systems are not linear. Systems are not linear. They are not from input, output, outcome, impact. Systems are complex. We need systems thinking if we are to have the impact we need. And the WHO has defined systems thinking. That systems thinking is an approach to problem solving that views problems as part of a dynamic system. So if it's a problem, it is not enough to increase pay. Systems thinking involves more than a reaction to the present outcome or events. Like payment is just one of the problems, but we need to go beyond it. It demands a deeper understanding of the linkages, the relationships, the interactions, and the behaviors among the elements that characterize the entire system. So we need to think beyond yes, WHO said that it is not a linear system. Care systems are interconnected. Look at what is in red. Care systems governance interconnects with medicines, with human resources, with the information system, with others, in order to serve the people. What happens in the spaces between the subsystems, like governance, like human resources, like financing, is important as what goes on with it, and is usually neglected. This is the core of system understanding, systems thinking, and also the systems thinking. The fact that systems are complex, are interconnected. Because systems are complex, they are always self-organizing. You increase the pay of health workers, they find a way to do it. Work. They are constantly changing. And then others whose salary was not increased begin to complain because they are interconnected. And getting change becomes a problem because there is usual feedback. Because systems are complex and are interconnected. So let me give one example, and I think I've chosen here an example of quality improvement in my presentation. Actually, the minister gave the one of payment of health workers. But let me take what the conference is about, which is quality improvement. You decide that you are going to do quality improvement. That is a governance decision, which is good. But it's not enough to say you do quality improvement and it will improve service delivery. You go straight to improving service delivery because you think maternal death is not reducing, less than do quality improvement, without thinking about other systems. What are the information systems? Is it showing that the health workers are present? Is it showing that the commodities are there? Is it showing that the human resources are there? Is it showing that the actual quality improvement that we are focusing on is actually available? And them are in the room, it's better, Prime Minister, what we say that most quality improvement initiatives do not necessarily have quality in them or enough quality. And two, they may not lead to, a lot of the reports show that many quality improvement initiatives don't lead to improved outcomes because of all these complexities that happens in the system, that things which need to be in place in order for it to work. And that requires a system strengthening. So therefore, what is a system strengthening? First of all, from a policy perspective, we have the minister, we have many policymakers here. So from a policy perspective, intentionality is the process of identifying and implementing the changes in policy and practice in the country's health system so that the country can respond better to its health and health system challenges. It starts with a policy intention and being clear on what is the policy. And I think it is very good that the minister was pointing out all those things she wants to see in the system, like a one system in terms of projects, in terms of financing. I think that is a good policy direction. But of course, policies need to be implemented. No, now at a more local level, at the implementation level, the system strengthening is defined as improving the 6 health systems building blocks and managing their interactions in ways that achieve more equitable and sustained improvements across health services and health outcomes. What this means that these building blocks and their consequences and their interactions need to be managed. The word management, I'm underlining it because I find it a critical gap within the system. Even today, we are struggling with, even me, I'm struggling with my presentation not being on time, but also the conference being on time, because the conference management cannot be an expertise of the doctors. WHO goes on to say that health system strengthening is a comprehensive, so it's not simple, it is a comprehensive and sustained becomes quite important, enhancement of the capabilities, the performance, and the resilience of the systems, managing those interactions intentionally to make sure that they are well managed efficiently to produce the outcomes that we are looking for. I will give you some examples of what are some best facts about a system that is working or that can be strengthened. And one, I usually say that to have impact or to have a system strengthening, you require good coverage. How many people are we reaching? But also quality. And when we talk about quality, the issue, it is not simple, small interventions. It is package of interventions that make a difference. There's an of doctors and other health workers And then you think, we think that we shall, because we demand pay, so they increase our salary, and then we think that we shall have better outcomes. But
Recording in
complexity
progress.
fails. So typical models are not linear, I said before. I'm going to use an example of a patient. And for me, health system strengthening can be compared to what doctors and nurses and others do with patients. Normally, when you have a patient, you start by like a correct diagnosis. Even for health system strengthening, you need to diagnose what is the problem and what is the goal that you are trying to focus on. So that's quite important. If you don't have a clear understanding of the problem, of the goal, you are not going to strengthen the health system. But also what is causing this problem. Then a correct
Recording stopped.
A correct intervention package. Like if
Recording in progress.
If you diagnose a patient, you also want to give the right treatment. Until you have the right diagnosis,
Recording
you cannot
stopped.
give the correct treatment. And then sustained and sometimes changing interventions. The minister talked about innovation. Yes, we need to be innovative as we do health system strengthening. Even if for patients, you are doing reviews, you are making sure that they adhere. So the way we treat individuals and we are successful is what we are meant to apply to a system. Do a correct diagnosis, have the right intervention, and continuously innovate to make sure that this innovations are working. When you have the right diagnosis, the right intervention, and you provide it in the right package, then you'll see a dose response. And I think I want to congratulate the minister and the ministry and the partners for all the improvement we've seen in the health system that have been presented today and later in the demographic surveys. Because it shows that we have improved and we can do more. So here is a framework, a simple framework that can be used when we are thinking about health system strengthening. And because of time, I'll not go into the detail, but it says what I've been saying, just like a patient. Step one, make a diagnosis. That diagnosis is with data, with consultation, is with groups, not as individuals. Number two, then based on that, you intervene. Don't intervene in complex systems when you don't have a diagnosis. What is causing the problem? Then as you do, you are constantly, you implement, but as you implement, you actually are using data to find out, is it working? And then you adjust. So just like you do your PDSAs, you can apply the PDSAs as an approach to health systems strengthening. But I think different here, you must learn to use that PDSA approach in delivering packages of interventions. So diagnosis is the starting point, continuous review. I'll give you one example, which the Ministry of Health has done with UNICEF and the Gates Foundation and others. And I think now it's such a national planning strategy. The CODES project is where we participated. We as School of Public Health, I was the PI at Makere and working with the ministry and the UNICEF. We started by diagnosis and going the lines. So districts, 8 districts where we started, they would come together and use data. That time they're using LHS, but now they're using DHIS2. But they need to use that DHIS2 better. And now also the DHS, the UDHS, to say how are we performing as a district, as a sub-county, as a parish. Based on that, you plan, then you implement, and you can apply quality improvement to it, and you have a system strengthening. And then reduce mortality. That was the approach. Our work was focusing on ICCM, and we already knew that for ICCM, just training without commodities, without human resource, without physical access, without utilization, without continuous utilization, you will not have impact. This is called the Tanhash model. But the point is you try to understand what are the things that we need to work on in order to make a difference. What is the current performance? What are the gaps? And based on that, you design interventions. So this was the diagnosis stage, and you go on to ask why? Why are we performing badly? And once you do so, you'll find solutions, and then you can apply interventions. So from problem identification to identifying the cause of the problem, and then to designing intervention. And then the management and leadership becomes critical in designing the intervention that we have identified here. But there are challenges to health system strengthening. One of them is accountability. The minister has actually alluded to this a lot, accountability in the system. Even said we should go and test for HIV and stuff like that, because that is accountability. Then most critical also, the way we use our resources is important. The issue of management, and then critically, and Honorable Minister here is a call to action. The decision space becomes important. If you are going to be designing and innovating and changing, then you should be allowed to be able to make decisions, including use of money, unfortunately, which is critical. So again, just as I summarize, systems are complex. If they are complex, they need very good leadership and management. And this is at all levels. I think my colleague, Professor Arch, presented that especially at the subnational, the health centers, etc., are not performing as well. He said as expected, but I don't think so. I think we need to improve the management and capacity at all levels. And if in the case of hospitals, beyond the director, we also need to is the ward manager trained in management. Do they know what to do? etc. So leadership is important if you are going to manage these complex systems, because they are very dynamic, and we need that capacity at all levels. In terms of management, we require managers in the health system at all levels. Managers plan. So one of the critical things, we need to train people in management to manage complexity so that they can plan, they can organize to implement what they have planned, they can motivate their staff, and they can also measure, control, and see how the system is performing. So one of my call to action is to improve leadership and management at all levels of the health system. Because with good leadership and good management, when they work together in a system, you get improved management systems because there is good management. But also there is a good climate of work environment. For the health workers whose salaries were improved, we need good management system to ensure that they are present, but also a way to motivate them so that we don't use fear to make sure they perform. That will lead to a system that is more responsive and willing to cause change, and it will lead into a system strengthening, and we can have results. So as a final slide, Honourable Minister, just to say that the take-home messages are, I see Dr. Okela, I don't know whether, can I?
To manage ourselves as adults. In the afternoon, there are breakaways, and if what I'm saying is not right, please let me know. The MC, I think, has the best guidance. I may mislead you. So let me invite the MC to say something about what happens after coffee, then when do we have lunch, when do we get back here for plenary in the afternoon, because we must finish what we set aside for today. Thank you very much. Over to MC. Please appreciate the chair for today.
Thank you so much, the session chair. Let's give him another round of applause because he has taken us through the official opening, and I think which is very good. Now, this is just administrative. We are going for coffee, and of course, I don't want to repeat his words. He said we are going to be responsible as adults. But the breakaway sessions are as follows. We have two. This is Ziba Hall. Then we also have Kama Hall, which is just on the other side. So when you look at your program, the Ziba Hall, which is this one, we are going to have leadership and governance. So there are a number of presentations. And of course, Dr. Mugai, he is still on the way. But in the meantime, we have somebody who has agreed to chair that session. Dr. Mary Mudiope, who is the program director of LPHS TB activity, which is a USAID-funded activity, will be chairing that session from Ziba Hall. Then from Kama Hall, we have Dr. Nkoye Abdallah, who was also from LPHS Ankole region, who will be chairing that session. And of course, you will introduce the presenters thereafter. And so we are going for coffee. It's just outside where you registered from. And we are going to come back after 15 minutes. Those of you, you have already made your choices which breakaway session you want to go to. And we shall take, according to, I didn't carry my Swiss watch, but according to the time check, it's 1:45. So we are going to be in those breakaway sessions since we are having a late coffee or tea break. So we shall be in those sessions up to around 1:45. That's when we shall break up for lunch. And further guidance will be provided to you in those guiding places. So our request, we are going just to allow our guest of honor, the Honorable Minister, of course, and our dignitaries to Okay, I've been guided for the tea. The ushers are going to usher you in because it's a small area and this is a big conference. So they will be ushering you in chunks. But the director, you are going to escort the Honorable Minister and of course Commissioner Emergency Health Services and our dignitaries on that table. Okay, I've been further guided that because the leadership and governance, those of you who are going to follow that track will be staying in this hall. And of course, since we are trying to catch up with the time, allow me hand over to the session chair to organize her presenters as others go for tea. So those who are going in Kama Hall, you'll be passing by the tea and then you proceed to that breakaway session. So a good afternoon and you're most welcome. Thank you. Session chair for Ziba Hall, Dr. Mary Mudiope. I hope you're already okay. Yes, she's coming. So, and may I alert the presenters, Dr. Nyeko Felbert, Wangubo Ayub, Naruge Prosi, and Lajara Betty Patiang, please be around so that the session chair doesn't struggle very much to look for you. Just be around because your session is starting. So, Mary, you are most welcome, and we are all yours. Thank you.
Good afternoon, everyone. We have been invited for break. Good afternoon, everyone. Thank you. Mary Mudiope, the project director for the USAID Local Partner Health Services TB activity. I'll be taking through the team that is remaining here and has focus on leadership and governance as one of the key building block in the health system. We have 7 presenters. Dr. Nyeko Filbert, I think I saw him around. Is he around? Dr. Nyeko? kindly confirm your availability. We also have Wangubo Ayub from Queen. Ayub, welcome. Naluge Prosi. Naluge Prosi, you are welcome. Do we have Lajara Betty? Welcome. And then Lucia Nakiaga. Kindly join me here.
Let's put this one a bit down.
They wanted me to start the session. Pick your cup. Pick your cup. Yeah, you're not the first, you're the last. No, so you're among number 3. You pick it. Those that have called out, kindly make sure that you pick your tea, your cup of tea quickly so that we can start the session.